Good afternoon, distinguished judges, ladies and gentlemen. I'm Mariyam Shazra. I'm an advanced diploma student following nursing at International Institute of Health Sciences. My research topic is assessment of public attitude towards the importance of mental health care and healthcare services provided in Maldives. So these are my key content. So mental health is the emotional and psychological well-being which states the individual's ability to use their emotional and cognitive capabilities to function in their everyday life. Mental illness affects 19% of the adult population, 46% of the teenagers, and 13% of children each year in Maldives. Due to the limitations of the geographical settings, limits the accessibility to mental health care and the mental health care facilities that are available in Maldives. There are very few mental health care facilities that is present in Maldives. So mental health is an increasingly relevant issue with mental disorders contributing to a significant disease burden in Maldives. Therefore, it is important to study and understand the awareness and attitude of public towards the importance of mental health care and to the services provided in Maldives. My objectives of this research was to assess the knowledge, awareness, and attitude So my objective of this research is to assess the knowledge, awareness, and attitude towards the importance of mental health care and the mental health care services which are provided in Maldives. The specific objectives were to assess the knowledge and awareness regarding importance of mental health to the public and to assess the knowledge regarding the mental health care services that are provided and to assess the attitude towards the mental health care services that are provided in Maldives. So this research is a quantitative descriptive cross-sectional study which was carried out among Maldivians within the age group of 18 and 40. It took a sample size of 120 participants which were conveniently selected from around Maldives within the age group of 18 and 40. This research was done through an online questionnaire which included 17 close-ended questions that was sent out. The exclusion criteria for this research is any participant who are eligible to do this study but who did not give consent, and any participant who is above or below the age group. The study area is the general public of Maldives with age above 18. So moving on to my results, demographic data from the 120 participants who took part in this research, 53% was female and 47% was male. and the majority was who responded was 73%. Their age was between 18 to 24. The education level, when I assess the education level of these participants, 36.8% has completed their O levels, 24.8% has completed their A levels, and 27% was undergraduate students. So when I assess the awareness towards the mental health, the importance of mental health, and 78% has said that mental health is very important for them, and 20% has not is not aware of that much importance of the mental health. And when I check the awareness of mental health services provided, 50% of the participants has said that they are aware of the mental health services that are provided, while the other 50% are not aware of the mental health services provided. When I assess their knowledge about the about mental health care, I asked them if whether this mental health mental health is can mental health deficit of mental health provided lead to risky behavior of the patients. So 55% said it is definitely going to lead to risky behaviors of the public. So when I assess their satisfaction towards the mental health care services provided, 33% is not at all satisfied about the mental health care services that are provided in Maldives, and a very low amount of people are actually aware, and they are quite satisfied with the services that are provided in Maldives. When I talk about the availability, 62% agreed that it should be available in all the islands, which is actually not available right now. It is not available in all islands. So the public they highly agreed that 37.5% of the participants highly agreed that they are not receiving proper treatment in the mental health care facilities, and 35.8% highly disagree that they do not get proper treatment for their mental health disorders. When I ask them, is it necessary to give mental health care in isolation, 68% said that it is 68% were not, maybe for some diseases they should isolate the patients, while 16% said they should be isolated, while 16% thinks that it's not really necessary to isolate the patients for mental health care treatment. When I talk about mental health care and the other health care facilities, 73.1% said yes, it should be mental health care and other health care facilities should be equally provided to the rest of the people. And when talking about the government funding, 84% said it should be provided, government funding should be provided, and it also 76% agreed that this mental health care is a national issue which should be addressed. So moving onto my discussions, the findings shows that mental health is indeed issue in Maldives. It is surprising to find that it is the youth only of Maldives that believes that mental health care is a national level issue which requires attention. 35.8% do not believe that mental health is adequately treated in Maldives, and 84.7% were not aware of a government funding towards mental health services. Therefore, since the mental health care and services provided do not live up to the standards that of the people of Maldives, it is imperative that the attitude towards mental health be improved and the quality of mental health services must be improved, thus contributing to significantly reducing the disease burden in Maldives. So my recommendations are awareness programs to be conducted by regarding mental health care and the importance of mental well-being can be conducted by the government, and early education of mental health disorders can be provided in order to create more awareness among the youth and improve the quality of healthcare services provided by improving the facilities, and improve the quality of mental health treatment by conducting proper training programs in order to have well qualified staffs, and also carry out more researches to find out the requirements of the patients with mental health disorders. These are my references. I would like to thank all staffs of IIHS for giving me this opportunity, and all the participants for participating in my research. Thank you. Any questions?